This presentation is for long-term care community nursing, and it will discuss the provider web portal, prior authorization, and claim submission for that program. Just a little bit about what we're going to go over in this video today. First of all, the Oregon Health Plan Agency, I'm going to do an overview on that so you understand the different components that go into the Oregon Health Plan Agency. We'll talk about the Medicaid Management Information System and the provider web portal into that system. We will discuss prior authorization and provider claims specific to long-term care community nursing agencies and independent nurses. So just a little bit about the agency here. You'll notice at the bottom of the page that there is a logo for the Department of Human Services, and then on the right side there's a logo for the Oregon Health Authority. The reason both are on the presentation today is because both are involved in long-term care community nursing and that program. So let's go back to the left for a moment. Department of Human Services has a division called Aging and People with Disabilities. You'll hear people refer to this as APD. Again, they're a division of the Department of Human Services, or DHS, and they maintain policy and program information for long-term care community nursing program with Medicaid. Now, if you go to the right side, DMAP, the Division of Medical Assistance Programs, that's a division of the Oregon Health Authority. We oversee provider enrollment and payment for Oregon Medicaid. And we maintain the MMIS. So that system that we're going to discuss a little bit later as far as prior authorization and claims, we maintain that system in DMAP. So that's why you have two different agencies listed here and different divisions of those agencies. So just so you have an idea of how we're all tied together into Oregon Medicaid. So let's talk about the MMIS process, the Medicaid Management Information System. So here's a few benefits of that system. First of all, nurses and nursing agencies can verify that services will continue before scheduling those services. So any Medicaid services that you want to schedule, you can look on the MMIS or the provider web portal and find out if that client is eligible and if their services are to continue before you schedule. Also, you'll have online access to view authorizations, verify client eligibility, and you can control your own billing. So you can view, or you can bill as often as you'd like to. You'll get immediate claim status. You can submit your own adjustments. And you can copy paid professional claims to submit new claims. So just a little bit about the MMIS provider IDs. Provider IDs are 6 or 9 digits long. So the newer provider IDs, so if you are enrolling with Medicaid within the past, if you have enrolled since December of 2008 or any time in the future from now, then your MMIS provider ID is going to be 9 digits long. If you were enrolled with us already prior to December of 2008, you probably have a 6-digit provider ID in the MMIS system. So these MMIS provider IDs are tied to the provider's National Provider Identifier, or NPI, and that's reported during the enrollment process. So they are tied together. Your NPI is reported under your MMIS provider ID. So the second item there, provider IDs can be for billing services and or for rendering services. So let me explain that just a little bit. And this will tie number 3 right into that. So nursing agencies and independent contract nurses may have provider IDs in the MMIS. So the way that works is if you are a nursing agency, you have a provider ID that you bill under, and when you bill with that provider ID, that ID is also the rendering provider. The reason I say that is because on the professional claim, there is a field for a rendering provider ID. So just so that it doesn't confuse you at all. Now, if we have any independent contract nurses where you're doing your own billing, you're not tied to an agency at all, you have a what's called a rendering provider ID, and you can also bill under that ID. So I want to make sure that that is clear. Keep in mind that if you are a nurse that works with more than one Medicaid program, for example, you might work with our medically fragile children's unit as well for children's intensive in-home services. Please know that you may have 2 different provider IDs, and when you're working with the long-term care community nursing, you need to work with the provider ID that is assigned to that program. So you may be billing, if you're an independent nurse, for both long-term care community nursing and children's intensive in-home services. Just make sure you're using the appropriate provider ID. Okay, so a little bit more about the MMIS system. All benefit plan and prior authorization information is in this system. And then you would be using the provider web portal, which is kind of like a gateway into information within MMIS, to verify information. So you're going to be looking at client eligibility. You're going to verify a benefit plan for that client. You'll be looking at the prior authorization that should be set up in the system before you can provide services and bill for them. And then, of course, provider claims. Now, you'll notice at the bottom of the page I have included a link to that provider web portal, and we will be going over that provider web portal in just a couple minutes here. Okay, so again, uses for the provider web portal. Client eligibility, so you're verifying a client's benefit plan and their dates of eligibility. Prior authorization, you're verifying service dates, procedure, and allowed amounts, and you're billing for services. And my mistake here, this should say long-term care community nursing. Okay, so accessing the provider web portal. If you have not accessed the provider web portal under the provider ID that you should be using for your long-term care community nursing, initial access will require your MMIS provider number. And again, there's a note there to use the ID that's associated with long-term care community nursing. And you need a PIN number. The PIN is issued by DMAP upon your provider enrollment. So as soon as you're enrolled as a provider, you should receive a letter in the mail, and it's a PIN letter from DMAP, and you'll need that PIN and your provider number to sign up for the first time. We're going to walk through that process in just a moment. And then once your account is set up, you can discard the PIN. Now, if you happen to be someone who has been enrolled with us for quite some time, and perhaps you're not newly enrolling, and you need a new PIN letter because maybe you didn't already set up that provider web portal account, all you need to do is contact our provider services unit, and their phone number is going to be at the end of the show today. Okay, so account setup and maintenance on the provider web portal. So just really a walkthrough with screenshots of what you're going to see in the process you're going to go through. This is what the PIN letter looks like. Now I've circled the areas that you need. So that first one is your provider ID with the middle section missing. And the reason we do that is for security purposes. You don't want to have the provider ID and the secure PIN written on the same note. Okay, so you'll see the first number and the last number of your provider ID with a bunch of dots in between. And then your PIN number is that other thing that's circled right there. It is case sensitive, so make sure that you type it exactly as it's seen here in the letter. And again, you should receive this in the mail once you are enrolled as a provider. You should get a letter, a welcome letter that tells you what your provider ID is, and then this will come separately. And that provider services unit phone number is at the bottom of this letter as well. So you'll see that right down here. Okay, once you have that, what you'll do is you will begin at the provider web portal homepage. And when you get to this page, all you have to do is go to that link right there. When you get to this page, on the account menu, you'll select Account Setup. That will take you to this page here. This is where you use your login ID, which is your MMIS provider ID, and your PIN number. That's step 1, and then step 2, you would click on Set Up Account. Again, there's a reminder at the bottom of this page. Please use the ID that's associated with long-term care community nursing. Once you click on Set Up Account, you'll be taken to this page here. You'll notice that the login ID and the PIN number are grayed out because they've already been entered and we don't have to re-enter them at any time. And then right down here, all fields are required. So you would fill out all these fields according to the account that you're setting up. We do recommend that the username here be something that applies to the provider rather than a person that works for the provider. So that way, if anything changes, let's say Jennifer Smith is working for you and she sets up this account and she puts J. Smith 76 or something like that, then that username can never change, and that will always be the username for the administrative account in the provider web portal for that provider. So you want to make it something that has to do with the provider or the agency. And then, of course, you have contact information for the current administrator. So if Jennifer Smith were the current administrator, it's okay if this says Smith Jennifer and has her information here. Now, just a couple of other notes here. Make sure that your answers are case sensitive. Every time you come in to change a password, or if you forget your password for some reason and it asks you these questions, those are case sensitive answers. Also, pay attention to the green section, the password requirements. Those are very important when you're entering your password, because if you don't enter something that meets these requirements, then it clears out and you have to re-enter everything. Another important note, make sure you check I agree way over here on the left. And then so continuing with the account menu on the home page, here's the entire account menu. Once you are logged in for the first time, so as soon as you set up that account, this is what your page looks like when you're logged in. So you'll see your provider ID listed over here on the left. You'll see some messages from the Oregon Health Authority if there are any. And then this is your account menu. So we're going to talk about this account menu a little bit more in the following pages, because I'm going to show you how to change information on your account, how to change your password, and how to set up other folks if you have anybody else working for you that needs an account to either check eligibility or do claims or any of that kind of stuff. So here's clerk setup. So on your account menu, and this is just step by step, so the first thing you do is on your account menu, click on clerk maintenance. And again, we saw that account menu on the previous page. The second thing you would do is click Add Clerk. That's actually over on the right toward the bottom there. And then you enter the clerk's information. Keep in mind that the password that you assign here, it must meet the requirements within the green box. You'll see the green boxes down toward the bottom here. But this is a temporary password. So as soon as this person logs in for the first time, they're going to be prompted to change that password immediately. And then number 4 is you choose from the available roles, the white box on the right, and you move those over to the assigned roles. So you can pick and choose what this person has access to within your provider web portal account. And then when you're done doing that, you click on Submit. Now I will tell you, perhaps you have someone working for you that works for other nurses or for other agencies doing billing or whatever. If that's the case, then that person likely has another account on the provider web portal. So they already have a login ID and password on the provider web portal. If that's the case, instead of filling out all this information, what you would do is you could click on Add Clerk and then search. Use this search button right here. So if you click on that, that's going to bring up a pop-up, and you're going to be able to search for that existing user ID in the system. And then you would be able to assign roles under your provider ID for that person. And then they only have one login ID and password instead of having multiple. Okay, so that's clerk setup. Next is account maintenance. So If you have an account on the provider web portal, whether it's the administrative account that you've set up with that ID and PIN, or if it's one of your clerks that you've set up, you would go to the account menu and click Account Maintenance, either you or your clerks, and then you could change information as needed, and then you would click Save. So that's just if you needed to change a phone number, an email address, or maybe you wanted to change your secret questions for some reason. Okay, next, also with the account menu, you could click Change Password, and then you would enter the current password, the new password, and then of course confirm that password, and then click Save. And that changes your password. Your password does expire every 90 days, so you'll be prompted when you log in to change that password. Also, if you enter the wrong username or password 3 times, you get locked out of the system and you have to call Provider Services Unit. So keep that in mind as well. All right, next step is client eligibility. So now you're in the system, you have all the access that you need, and you need to make sure that a client is eligible for services. So the way you do that is, here's your home page again, and your menu up here. What you do is click Eligibility. That will take you to this screen. Of course, it'll be blank at the time that you get to it, and you'll need to enter client information. Now, this green box down here is a little bit different. This tells you what combination you can use to identify the client. So one of these combinations has to be used. Okay, so that's the information you enter for the client. And then you enter a from date of service and a to date of service. Keep in mind that you do need to enter that as a 2-digit month, 2-digit day, 4-digit year. If you enter it in that format, you don't have to enter the slashes. Also, your to date of service can only be through today. You cannot look up future eligibility. And then one other note is your from and to date of service can be 1 day, or it can be up to a 13-month span of time. And then you would click Search. Once you click Search, as long as that client is found, you should get an eligibility file. So this is where you're going to be looking for benefit plans that cover long-term care community nursing. So here is my client. If the client has Medicare, you'll see dates listed under the Medicare section. You will usually see a branch ID and phone number here. And then you'll see benefit plans if they are eligible. And then this yellow box here tells you which benefit plans cover long-term care community nursing. You'll notice that this client has ICP, which stands for Independent Choices, and that's covered by long-term care community nursing. A couple of other things you might see, and it shouldn't really determine how you bill or anything, but you might see third-party liability listed. That means the client has private insurance, and if that private insurance does cover the services, then you would bill them prior to billing Oregon Medicaid. Managed care section would show whether or not we have this person enrolled in a plan with Medicaid. Lock-in would show whether or not this person was locked into using a specific pharmacy. And then service limitations has to do with a specific procedure code, so that's something that you wouldn't use. So there's our eligibility file. We can see that this person was eligible. You'll also notice your effective and end dates on the eligibility file are going to be within the date range that you searched for. So my from date on my eligibility file was July 1st, and my to date was August 7th. Okay, so this person's eligible. Now what we need to do is we need to make sure this person has prior authorization for the services. Every long-term care community nursing service must be prior authorized. So let's talk a little bit about that process. So Again, services must be prior authorized before the services take place. And this is what the process is. So the first thing is the nurse or the agency completes the authorization form and returns it to the case manager along with the assessment and the service plan. That form, SDS 4102, we'll find that online. I have that as a resource toward the end of the slideshow, and I'll show it to you. Also, I have it as the next slide. I just kind of give you a printout of it. So secondly, the case manager will review the authorization form and set up the prior authorization and the service dates in MMIS. From there, what you need to do as a nurse or as an agency is verify the authorized units and services through the provider web portal. Now, after we take a brief look at the form, then I'm going to show you how to complete that number 3 process there, looking on the provider web portal. So here's the form, and again, there is a link to the long-term care community nursing page on our website at the end of the show. And we will go there and I'll show you how to find this form on that page. So looking up the prior authorization on the provider web portal, this is the home page again. Under prior authorization, you would select search. Once you click on search, what happens is at the very top you'll see a list of recent prior authorizations. Up to 10 of your most recent prior authorizations will show up there. So if it is one of those 10, all you have to do is click on it to view it. If it's not one of the 10 that shows up there that you need to look at right now, what you would do is use this section 2 down here, and you would enter criteria for that specific authorization. So you could enter a client ID, you could enter a specific procedure code, and then you could click search. And what will happen when you click search is your list of the most recent PAs stays up at the top, but then you'll get a list of search results below the search screen. So that's what that looks like right there. And again, your search results, all you would need to do to look at those is just click on one of the rows. The only reason you would not get a search results list is, first of all, if no rows are found, so it doesn't find anything and it'll actually tell you no rows found, or if your search criteria is so specific that only one PA is found in the system, PA being prior authorization, then it'll just pull that one up instead of giving you a list. So once you enter the prior authorization, this is what it looks like right here. So you'll see the basic information about the client and the clerk at your office that filled out, or the clerk at, the office that put in the prior authorization. So you'll see that information there. If there's a diagnosis, you'll see it listed here in the diagnosis section. And then right down here at the bottom, you'll see line item information. And what I like to point out here is if the prior authorization is approved, what you'll see is authorized dates and units and dollars listed in this section that's circled right here. And then I also want to point out that when you bill, you must bill exactly what's on the prior authorization. So for this specific one, you can see, first of all, it's not authorized yet, but if we saw an authorization of this one unit at $1,200, then this provider would be able to bill this code for one unit, $1,200, on this specific date. Now, if it's a date span, you are approved for up to that many units within that date span. And then the next thing I wanted to discuss is the status codes that you might see on a prior authorization. So evaluation just means that no one has reviewed this authorization yet. And I can't imagine that you would see that one because they're putting it in, the case manager's putting it in and approving it as they put it in. So you probably won't see that. Pending would be if they're in the review process and it's not there yet. Approved and denied are pretty self-explanatory. We don't really need to go into that. Just make sure that if it is approved that you're looking at the authorized dates and the authorized units and billing within those parameters. Informational means that no PA was required, and withdrawn means that it's a duplicate PA. Now, you're probably not going to see most of those status codes, but I like to give you an idea of what they mean, just in case you ever do come across them. So that's our prior authorization, where we verify that services are authorized before providing the services and billing for them. And that brings us to billing. So again, we're beginning on the provider web portal. Here's our home page here. And on the claims menu, you would select professional. That will take you to a blank professional claim form. So this is what the whole claim form looks like. Don't be intimidated because you'll notice on the right there, I've put a little note there for you. Long-term care community nursing agencies and independent nurses will only need to fill out Section 1 and Section 5. So there went some of that intimidation. All right, so let's go ahead and look at Sections 1 and 5. I've separated each one on its own slide. So here's Section 1, and then I've told you what the required fields are. So first of all, you need to put in the client ID. As soon as you put in that ID and you click somewhere else, then what you'll see is the person's name and birth date. If that doesn't come up, then try using this search link right here. That'll bring a pop-up where you can search for a specific client. And then right here you need your from and to date of service for this specific claim. So again, you're controlling your own billing. Your prior authorization may be good for a month, but maybe you're billing weekly. That's okay. You would just put in the from and to date of the week. And that's okay as long as you're billing within the parameters of that prior authorization. So that's Section 1. That's all that's required. And then that Section 5 is on the next page. And really not too much required over here either. We have our from and to date of service, our units that we're billing, so how many units per that prior authorization that you're billing for the dates of service that you're billing for, your specific charges for those units, and then you need a place of service code. I have a 12 here because 12 means home. If you needed to search for a place of service code, you could do that as well. And then you put in your procedure. Now, if you have more than one procedure to bill, let's say that you're doing this assessment and you're also doing some delegation. What you can do in this section is right here you can click to add a second line. So what you'll see here is we're on item 1. As soon as you click on add, all of this information is pulled up under item 1 right here, this blue line here. And this changes to item 2. You enter your service dates, your units, charges, place of service, and procedure for delegation as well. And you can add as many lines as you need to bill for multiple things all on one claim. When you're done with that, you'll go to the bottom of the claim, and you'll see your claim status of not submitted yet, and your options are to submit the claim, and that will cause it to process through the MMIS, or cancel. Cancel will clear anything that you've done and take you back to a blank claim form. So once you click on submit, I've just got a full page view for you again. This is what your claim looks like, and then right down here you have your claim outcome and reasons. And I'm going to show these to you on the following pages. So if your claim status is paid, then you have some different choices down here. First of all, you'll see paid. You'll see an internal control number. That's what ICN stands for. You may or may not see a paid date right away. The only reason for that is the financial cycle happens every weekend. and you'll see the paid date once that financial cycle has happened. But what you will see is an allowed amount. Not necessarily the paid amount. Usually it's the paid amount unless you have other payers prior to Medicaid. So for example, Medicare or a private insurance company that you've billed prior to us. But this will show you the allowed amount in full. And then down here we have HIPAA adjustment reasons. These tell you why the claim processed the way that it did. And hopefully if you have a denied claim or one that you feel is inappropriately paid, this explains why. Now your choice is on a paid claim because you can do a claim search and look for this claim and find it. You can cancel changes. That just means if I'm making changes because I'm thinking I'm going to adjust the claim, that I can clear out those changes and not submit it. Adjust allows me to make those changes and make an adjustment. Basically what that does is it pulls the old claim and it puts a new claim in its place. Make sure that you're always working on the most recent claim for that specific service when you're doing adjustments. Void completely voids that claim out, and if you had received any payment at all, that money is taken back in the next claim cycle. And then I mentioned this earlier, excuse me, on a paid claim you have the option to copy the claim. So if you are serving a person repeatedly and billing for them maybe weekly, you would be able to go into a previous claim, copy that claim, make some minor changes to it, like the dates of service, the units and charges if needed, and then submit it as a brand new claim. Just be careful when you're using those functions because, again, the adjust, the void, and the copy claim, you're making some pretty serious changes in the system. Adjust and void, you're pulling a claim and either replacing it with something or replacing it with nothing. And then that financial piece will be a little bit different. And then the copy claim, if you're using that, just make sure that you're changing everything that needs to be changed for those additional services. Now your other option that you might see is a denied claim. The denied claim has different choices at the bottom. You can resubmit the claim. So you would be able to make changes right there on the claim and resubmit it as a brand new claim. Make sure you pay attention to your internal control number. Anytime that you are adjusting or resubmitting a claim, every time you resubmit or adjust, you should get a new internal control number. So pay attention to that. And then cancel works the same way as it does on all the other pages. It's just if you had come in and started to make some changes and you decided you didn't want to process those changes, you could click on cancel. Now right down here, just a note down here, the only other claim status you might see is suspended. It basically means that the claim is pending because a person needs to review what was submitted and decide whether to deny or pay that claim. So if you have submitted a claim for a service and it is suspended, if you were to try to submit another claim for that same service, it would deny as a duplicate because this one is still pending. In the event that your suspended claim changes to denied, then you can resubmit. In the event that your claim changes to paid, you would be able to adjust it if needed. But while it's suspended, you cannot do anything with it. All right, so now I'm going to show you how to search for a claim. Because sometimes what happens is you submit your claim, and then you realize something's wrong. Maybe it didn't pay appropriately, or maybe it denied and you figured out what the problem is and you need to go back in and make a change to it. So what you can do is you can search for existing claims by going to the Claims menu and selecting Search. You can enter search criteria and then click on the search button on the right there. And you can search by any of these different fields here. I just put the client ID in. If there's more than one claim found by your search results, then you'll get a list. And you can click on a row to view the entire claim. If your search criteria is specific enough that only one claim is found, then what will happen is instead of getting that list, you'll just get that claim. And it will look like that completed claim that we looked at previously. Okay, so we are to our resources section. So let's go ahead and take a look at that. I did want to show you the website real quick. That is what the website currently looks like today as I'm recording this. Who knows, that picture may change in the future. But if you would go to this website here, I'm just going to go ahead and click on it. We are on that website. What I want to show you on this website is if you will, over here on the left, there's a menu. Go to Tools and Resources. And you will get a list of forms, documentation, that type of stuff that you might need. And this very first one right here, I'm not saying it will always be the first one, but currently it is, the SDS 4102 prior authorization. That is that form that we looked at that's in the slideshow. And you would be able to click here for a fillable PDF of that form. Lots of other long-term care community nursing forms are here. You'll see the service plan here. You'll see the service summary. You'll see the rules, direct deposit, lots of stuff that you might need for long-term care community nursing. So keep an eye out on that Tools and Resources page. If you don't see what you need on this current page, you can click Next right here, and that will take you to more information. You'll also see a Frequently Asked Questions page right over here. So lots of stuff over here to click on and take a look at. Just make sure that you keep an eye on that Tools and Resources because that's going to be a huge resource for you. So let's go ahead and head back over to our slides so I can give you a... So that was the website. And then if you need any help with the provider web portal or any of the information that you're seeing today, we do have a DMAP Provider Services unit. There's their email and their phone number. And we also have a DMAP Provider Training email address. So you can contact either of those parties at any time if you have any questions about the video that you're watching today, or if you're in the provider web portal and you run into a problem while billing or looking at a prior authorization, then Provider Services Unit is a great resource for you. All right, that's all for today. Thank you so much. Contact us if you need us.